So as we think about breast cancer, we want to think about length of estrogen exposure to the breast, and one of those factors is early onset of the menstrual period or late onset of menopause, okay? Now, there are other factors that increase estrogen in a woman's body, and one of those is alcohol consumption. And by no way are we saying that you have to completely abstain, but we do want our audience to know that there's a linear relationship to the amount of alcohol you consume and the amount of estrogen your body produces. So moderation is kind of the message here, and I'll go to my good friend John. Are there approaches where you can still go out to a party, have fun, but yet not go overboard? What do you tell your clients about that?
Absolutely. I mean, like you said, it's all about modification or moderation. There are ways to prepare yourself kind of ahead of time if you're going to do that. And Kelly and I actually talk a lot about the nutritional ways to navigate enjoying life and going out and having a good time, because that's part of life. The way I've always taught it is there's nothing that I'll tell you can't have. But what you want to do is the majority of the time make the better choices. And nowadays there's so much information out there that the majority of people understand that, hey, having this sugar-filled margarita is probably not the best idea, or having pizza on top of that is probably not the best idea. So the way I teach it, and I've always taught it, is if you're going out for drinks, you kind of got to pick your spots. So I discourage people going to like an Italian restaurant. We're going to have a ton of pasta and heavy fats and all this other stuff that's going on with that, and have the wine and drink. So it's kind of all in one. So I think keeping volume low, is important. Keeping sugars low.
So maybe if you're going to have one or two drinks, maybe you don't pick the pasta.
Right.
Maybe you pick the salad or something.
Exactly. Go with something, kind of mitigate your losses, and I always call it damage control. Another thing too, when you're out drinking, is match each drink with a glass of water. The more hydrated your body stays, overall, at any point, the better your body's going to function, the more efficiently it's going to run. You're going to push out the toxins more efficiently. When you dehydrate, you slow your body's entire processes, and that's what alcohol does. So by staying hydrated throughout that, you're going to be a lot better off overall.
That's great
yeah.
words. Great
Simple
words.
stuff. Yeah.
Now, as we move to the next one, what happens when you're dealing with the quite debilitating side effects that many women experience when they enter menopause? And maybe my wife Debbie could talk a little bit about her consideration of using estrogen replacement, which sometimes we do recommend for a short period of time, because it really can help you get over that transition period. But I know that you had to think about that, and yeah.
I did, and I know it's, for each individual, it's kind of their own journey. However, I was struggling with hot flashes. I wasn't sleeping well. I just had no predictability with my periods, and felt like I was gaining weight, really sluggish, just having a real hard time. And I did go to see an obstetrician, and it was a real eye-opener for me, because I was telling her about my symptoms, and she did a lot of blood work on me, and she came back to me and she gave me basically two options. And she said, well, Debbie, you can either go on to hormone replacement therapy, or I can send you to a psychiatrist and we can put you on antidepressants. And that's when I walked out of the office and I said, I'm just going to have to deal with this naturally on my own. I had a great supportive spouse. My children are great, but I felt like it was 1950 when those were my choices: hormone replacement therapy or antidepressants.
And how are things now?
They're great now. I'm, over the hump. I feel really good. I think it's really important to maintain your fitness, try to eat really clean, get lots of rest, and just know that you're going to have your challenges, but it can be done. But I do understand also that there is an opportunity, there is a window where it's beneficial for women to have hormone replacement therapy. I was also adopted, and I don't know my medical history, so therefore I think it's just really risky for me to introduce anything like that into my body.
That's a key point for our viewing audience, that there's no black and white here. We're not saying it's completely wrong to take hormone replacement as you're going through the side effects of menopause. Under physician supervision, there is a place for that, okay? But we think that that should be limited in terms of a certain amount of time, okay? Okay, so now let's talk about factors that decrease the risk of breast cancer. Well, some of them are obvious, okay? Of course, a having a baby breaks your menstrual cycle. You don't have a menstrual period when you're pregnant. So having a child, generally before the age of 27, is associated with a reduced rate of breast cancer. And breastfeeding also, and some women do have their period while they're breastfeeding, while they're lactating, but it's usually irregular and it's usually reduced a little bit. So breastfeeding, of all the great benefits that breastfeeding will do for your children, one great benefit that it will do for you is confer a decreased risk of breast cancer. So we are big advocates of breastfeeding. We don't like to see obesity at any age, and we do have a problem across the United States with that right now. But actually, obesity is an interesting factor in the development of breast cancer. In early years, being an overweight adolescent or young adult may actually confer a protection against breast cancer. And the reason for that is oftentimes obesity interrupts the menstrual cycle. Okay? However, obesity later in life, okay, since fat adipose tissue is a primary source of estrogen production once you're no longer making estrogen through your ovaries, obesity later in life is a risk factor for the development not only of breast cancer, but other cancers as well.